Dear audience, dear chair, let me introduce you to my PhD topic, Insight in the Management of Patients with Liver Diseases. My name is Petrana Martinekova. Currently, I'm second-year PhD student, and I work on my projects with the great help of my supervisor, my SMS, and our statistical team. My vision is to improve the care of patients with liver disease with evidence-based, but also personalized approach. And my mission currently is to investigate the effect of micro and macronutrients and the usefulness of biomarkers in liver diseases. To achieve my vision and mission, currently I am working on two specific goals. Both of them use the methodology of systematic review and meta-analysis. The first one considered translating the role of vitamin D supplementation in chronic liver disease, and the second one about the diagnostic accuracy of biomarkers in cirrhotic patients with bacterial infection. So let me start with the first one, which started September 2022. It is important to note that only in Europe in 2019 there were almost 300,000 deaths due to chronic liver disease. On average, our patients die prematurely and 2/3 of mortality occur below the age of 65 years. On the other hand, the vitamin D deficiency is quite prevalent in our population, accounting for 49 to 86%. It has been found that severe vitamin D deficiency is associated with all-cause increased risk mortality in patients with liver cirrhosis. Moreover, vitamin D receptor, which is located in the nucleus of the multiple cells, can regulate over 200 genes. So our aim was to evaluate the effectiveness of vitamin D supplementation in patients with chronic liver disease. We asked the clinical question: can vitamin D supplementation improve survival and outcomes in patients with chronic liver disease? And to answer this, we used the PICO framework, the adult population with chronic liver disease. Intervention was standard of care plus vitamin D supplementation, control standard of care plus placebo or no additional interventions. And we look for several outcomes, for example, survival, change in liver enzyme, or change in liver steatosis and fibrosis. And we hypothesized that vitamin D supplementation can improve outcomes. We conducted the systematic search on November 2022 with the search key, which you can see over here. The last domain is dedicated to the process of randomization because we decided to include only randomized clinical trials. After rigorous selection process from 10,000 articles, we identified 46 eligible studies. And then when it comes to outcomes, you can see over here that some of them were placed in the main manuscript, such as survival, liver steatosis, fibrosis, insulin resistance measured by HOMA-IR, and liver enzymes, while the others we placed and depicted in the supplementary material. So let me show you our hardest outcome, which is survival. As you can see over here, we were able to include 8 randomized clinical trials, and we decided to divide it into 6-month survival and 12-month survival. Based on the risk ratio, you can see that there was no difference in the supplemented and the control patients. Second of all, we decided to focus on the insulin resistance measured by HOMA-IR, and you can see on this figure that we actually divided the outcome based on the length of supplementation when it was supplemented less than 3 months and longer than 3 months. But overall, there was better insulin sensitivity in the patients who were supplemented with the vitamin D. As the last and the third figure of this project, I want to show you the summary forest plot for the liver enzymes. As you can see the number of studies which were able to be included in the analysis, and also you can see that for all liver enzymes, there was a decrease in the vitamin D group. On the other hand, what I need to state that based on the small effect size, this effect is rather clinically questionable. So what are the strengths and limitations of this first project? The first thing is that we decided to include only randomized clinical trials to reach the highest level of evidence possible. Second of all, we wanted to provide a comprehensive and complete look, so we investigated many parameters, including liver steatosis and fibrosis, which was meta-analyzed for the first time. As the main limitation, I want to highlight the high heterogeneity which we encounter. One of the reasons is also due to heterogeneity in the administration protocol of the vitamin D, because it differs in the forms, in the dosage, and in the length of the supplementation. Based on this, I can conclude that vitamin D does not improve survival. Vitamin D supplementation can ameliorate insulin sensitivity and may reduce two of the liver enzymes, but to the clinically questionable effect. As the main implication for the practice, I would say that vitamin D can be used as adjunctive treatment for insulin resistance, especially if we consider that for NAFLD patient, we still have the base treatment, which is lifestyle modification. And vitamin D does not improve, but nor worsen the other outcomes. As for the implication for the research, I would say that we would like to see more homogeneity in the supplementation protocol based on the studies that we already have, and also it would be worth to investigate the liver fibrosis and steatosis, because we were able to include only 3 trials showing the tendency for improvement. So where we currently are, actually the manuscript was submitted this month, the 4th time, and I hope that this time we will be successful. So, the second project, diagnostic accuracy of biomarkers in patients with cirrhosis and bacterial infection. As I said, our patients die prematurely, and bacterial infection accounts for 30 to 50% of mortality. Also, bacterial infection is one of the most common precipitant factors for acute and chronic liver failure. When compared to the general population, patient with cirrhosis has 4 times higher risk for mortality. While early antibiotic treatment is crucial when antibiotics are really indicated, on the other hand, we also need to consider the increasing prevalence of multi-drug resistant bacteria also in this specific population. So we aim to evaluate the diagnostic accuracy of biomarkers in patients with liver cirrhosis and bacterial infection. And to answer the question, what is the most accurate biomarker, we use this time PERT framework. You can see that as index text, we have here C-reactive protein or procalcitonin, which are well known, but also biomarkers such as presepsin or interleukin-6 or neutrophil to lymphocyte ratio, which has become more popular, I would say, in the recent years. As the reference test, we have microbiologically determined infection based on the culture positivity, but also clinically determined infection based on the guidelines definition. And we looked for several outcomes, sensitivity, specificity, and area under the curve, among others. We do this because we believe that with the early detection of bacterial infection, we can decrease, hopefully, mortality of our patients. We conducted systematic search June last year, and you can see the flowchart of selection here. So we started with about 15,000 articles, and currently me and 3 TDK students, we are at the stage of full text selection where we have about almost 1,000 articles. With my TDK students, I completed the majority of the pool, and we are also working on the data extraction. And here you can see just a brief approximate summary of the biomarkers that we found in our selection process. So for the CRP and procalcitonin, it seems right now that we would have about 30 full text eligible, and then about 10 full text eligible for interleukin-6, presepsin, and neutrophil to lymphocyte ratio. On the other hand, we found also additional biomarkers that we didn't think of, and this will be our discussion within our team, such as reagent strips or lactoferrin. So here is the summary of my projects. Currently, the first one is under review, and the second one I plan to publish in June 2024. Thank you for your attention, and I would close with the quote of Italian writer, "If understanding is impossible, knowing is necessary." Thank you very much.
Okay, I'll go first. So I have a question for your first project. As far as I'm aware, there's a difference in vitamin D deficiency and need for supplementation based on region. So northern countries needed more than southern ones. Did you see any differences, regional ones?
That's very excellent question, I would actually say, because based on our research, we actually found only 5 studies performed in Europe and 1 study performed in the United States. There are 2 which were conducted in Africa, and the majority of them, like 80%, coming from Asia. So I cannot really say, or I was not able to really divide it into based on the region for this.
Okay, thank you.
Even though if we consider that both like European Association, American Association, Asian Association, all of them say in their guidelines that vitamin D should be supplemented if the deficiency is found in our patient, about 400 to 800 units, but we don't have studies to really support this statement. Thank you.
Thank you for the answer.
Congrats to nice presentation. I would like to ask regarding the second topic. I saw that you used the ferritin as biomarker at the beginning, but I didn't see any results. So there was no articles, anything about the ferritin?
Yes, this is the proper answer. We didn't find a study which would evaluate the ferritin for this.
That's shame.
It was just the first thought that we had, but we didn't find it.
Yes, because I like ferritin as a marker very much, so it's very interesting one.
So chronic liver disease is a slow progressing disease, so I would not expect any difference in 6 months, 12 months time frame. So I would better choose 2 years, 5 years survival. Maybe if you would have data on that, you might see some survival benefit under treatment with vitamin D. Do we have any data about that or longer term treatment?
I don't want to say the wrong answer now, but as I remember from this analysis, we had only for 12 months and for the 6 months. I would recheck the articles, but this was the only that we were able to see. So we don't have data for this.